What's going on, guys? Welcome back. We are continuing on our GCSE psychology journey, and in this video we're going to be looking at depression. So let's get on it. So what are some of the characteristics of clinical depression? Well, sadness is one, but sadness is a normal human emotion that everyone experiences from time to time, and it may be triggered by events such as a loss, disappointment, or stress. But importantly, sadness does not typically impair a person's ability to function in daily life for an extended period. So that's the difference between sadness and depression. Unipolar depression or major depressive disorder. So unipolar depression, also known as major depressive disorder, is a mental health condition characterized by a persistent low mood, loss of interest or pleasure in most activities, and a range of emotional and physical symptoms. It lasts for weeks or months, often without a clear external cause. It interferes with daily functioning, such as work, relationships, and self-care. It also may include symptoms such as fatigue, so feeling really tired, feelings of worthlessness or guilt, sleep and appetite disturbances, so you might sleep more or less, or you might eat more or less, and even thoughts of self-harm or suicide. Unipolar depression is a clinical diagnosis and usually requires psychological treatment, medication, or a mix of both. Bipolar disorder. Bipolar disorder is characterized by extreme mood swings between manic and depressive episodes. Symptoms: manic episodes, high energy, reduced need for sleep, very impulsive, and sometimes grandiose ideas, so really big ideas. Whereas a depressive episode, so it goes from one to the other, manic to depressive. A depressive episode will be the opposite. It will be very low mood, persistent sadness, a lack of interest, and sometimes again thoughts of self-harm. So what are the causes and what are some of the impacts? So some of the causes of bipolar disorder. Bipolar disorder is influenced by genetic predispositions, environmental stresses, and changes in brain structure and function. Remember, a genetic predisposition doesn't mean that someone is guaranteed to suffer from whatever the condition is. It just means that given the right set of or wrong set of circumstances, they are likely to or more likely to suffer with this condition than somebody who doesn't have that predisposition, but it isn't a guarantee. Impact on daily life. Bipolar disorder can severely impact relationships, employment, and increase the risk of co-occurring issues such as substance abuse to try and manage these mood swings between one and the other. So the ICD, the International Classification of Diseases. The ICD is a globally recognized diagnostic tool developed by the World Health Organization, and it provides a standardized system for classifying disease and health-related conditions, including mental health disorders such as unipolar depression. In the context of diagnosing unipolar depression, the ICD, which is in its 11th revision, outlines specific criteria and symptom patterns that clinicians must consider. And these criteria ensure consistency and accuracy in diagnosis across different countries and healthcare systems. So some of the core symptoms: the ICD states that for a diagnosis of unipolar depression, the individual must exhibit at least one of the following core symptoms. So persistent low mood or sadness, loss of interest or pleasure in normal enjoyable activities, and decreased energy or increased fatigability. Some additional symptoms alongside the core symptoms: feelings of worthlessness or excessive guilt, poor concentration or indecisiveness, and changes in appetite or weight, sleep disturbances, so insomnia or hypersomnia, psychomotor agitation or retardation, recurrent thoughts of death or suicidal ideation. Exclusion criteria, so things that will exclude them. To confirm a diagnosis of unipolar depression, clinicians must rule out other possible causes such as bipolar disorder, bereavement, substance use, or medical conditions that could better explain the symptoms. So looking at the duration and impact, so symptoms must persist for at least 2 weeks and cause significant impairment in personal, social, or occupational functioning. Severity levels: the ICD-11 categorizes depressive episodes into mild, moderate, and severe. This classification is based on the number and intensity of symptoms and the level of functional impairment. So what are some of the theories of depression? So biological explanation, so the influences of nature. Imbalances of neurotransmitters in the brain. Behavior can be influenced by the levels and functioning of neurotransmitters. These are the brain's chemical messengers. Make sure you guys check out the previous videos for more details on neurotransmitters. Serotonin, a key neurotransmitter, plays a crucial role in mood regulation, appetite, and sleep. An imbalance of serotonin, often a deficiency, has been strongly linked to mental health disorders such as depression and anxiety. And this supports a biological explanation of behavior, suggesting that some individuals may be predisposed due to genetic or brain chemistry. Psychological explanation, so the influence of nurture. Negative schema. So schemas are mental frameworks developed from past experiences that influence how we perceive and interpret information, kind of like mental pictures of what things are and how things should be. People with depression often hold negative schema, such as seeing themselves as worthless or believing the world is hostile. And these maladaptive beliefs are usually formed during childhood or after repeated negative experiences. This aligns with the nurture perspective, emphasizing how environment and upbringing shape our thinking patterns and emotional responses. So negative attributions. Attribution theory explores how individuals explain the causes of events, especially negative ones. People with depression often make internal, stable, and global attributions. For example, saying things like, or thinking things like, it's my fault, it will never change, and it affects every single thing. Such thought patterns contribute to and maintain low self-esteem and hopelessness. This explanation again highlights the role of life experiences and learned behavior, consistent with the nurture approach in psychology. Interventions or therapies for depression. So the use of antidepressant medications. What are antidepressants? Well, these are prescribed medications used to treat symptoms of depression by altering the brain's chemical balance, primarily targeting neurotransmitters such as serotonin and norepinephrine. The common types are SSRIs, or selective serotonin reuptake inhibitors. Some examples of these are fluoxetine, and these are commonly prescribed due to fewer side effects. SNRIs, so serotonin and norepinephrine reuptake inhibitors, and these affect two neurotransmitters, of course, serotonin and norepinephrine. And then we've got tricyclics and MAOIs, and these are older classes with far more side effects, and these are much less commonly used nowadays. But how do they improve mental health? Well, by increasing the availability of neurotransmitters in the brain, they regulate mood, reduce anxiety, and alleviate symptoms such as low energy, poor sleep, and a lack of motivation. This is, however, quite a reductionist perspective, focusing solely on chemical imbalances as the cause of depression, potentially overlook psychological and social factors that may be impacting the individual. Cognitive behavioral therapy, or CBT. So what is CBT? CBT is a structured, goal-oriented psychotherapy that helps individuals recognize and challenge unhelpful thoughts and behaviors, replacing them with more realistic and adaptive patterns. How does CBT work? Well, it identifies negative automatic thoughts, so things such as like, I'm a failure, I'm no good. It challenges these with the evidence that supports them, or the evidence behind them. It then replaces these with balanced thinking, so things such as like, I've had setbacks, yes, but I've also achieved several things. So it replaces them with balanced thinking. It also encourages behavioral activation, so engaging in positive, meaningful activities, particularly ones that once brought you pleasure and a sense of achievement. Benefits to mental health. CBT empowers individuals with coping strategies. It reduces relapse risk and provides long-term skills for managing distress, especially effective for depression and anxiety disorders. It takes a more holistic perspective, so CBT adopts a more holistic view of mental health, addressing the interactions between thoughts, emotions, and behavior within the individual's social context, as opposed to the reductionist approach what antidepressants take. So it's important that we have a good understanding and know about Wiles' study for you guys' exams, so let's crack on with that. So what's the aim of this study? Was to investigate whether cognitive behavioral therapy is effective in treating depression in patients who had not responded to antidepressants alone. The method, it was a randomized controlled trial, was a type of test, a kind of study that it was, at RCT. There were 469 participants who suffered from depression from GP practices within the UK. All of the participants were already taking antidepressants but were still suffering from depression. The procedure was that participants were randomly split into two groups. One who had their usual antidepressants but also had CBT. One who continued just taking their antidepressants and didn't have the intervention of cognitive behavioral therapy. Now, CBT was delivered over several sessions by trained therapists, and depression levels were measured using standard questionnaires, for example, the BDI. And what were the findings? Findings were that the CBT plus the medication group showed greater reduction in depression symptoms, higher recovery rates, and benefits were still seen at 6 and 12 months follow-ups. So half a year and a year later, they were still seeing positive benefits from the interaction of CBT as well as the medication. So in conclusion, CBT is an effective treatment for depression, especially for people who do not improve with medication alone. Quick evaluation, so what are some of the strengths and weaknesses? So strengths, high validity due to real clinical settings. It was a large sample size, which equals more reliable results. They were randomly allocated to reduce any kind of bias happening. In terms of weaknesses, CBT requires time and trained therapists, and this isn't always something that is accessible. Some improvements may be due to placebo or therapist interaction, and the participants knew about their treatment, and this could have potentially led to some demand characteristics. That's when a participant reacts in a way that they believe that the researcher would prefer. Alright guys, so hopefully that gives you a better understanding of depression as we continue on with our GCSE psychology journey. Make sure that you guys rewind the video, pause it, make notes as you need to. Also make sure that we like, we subscribe, we comment. Don't know why you haven't if you haven't already. I will catch you guys in the next video. Look forward to seeing you then. Peace.